Hello, I am Belen Rojas.
And I am Nicole Michel.
I am 18 years old and I am an incoming undergrad student here at the University of Arizona.
I am 15 and I am incoming junior at Douglas High School.
Hi, my name is Lourdes Castanon. I'm the director of the Burn and Complex Wound Program. I had the pleasure of working with Belen and Nicole this summer, and just wanted to say that it was an absolute pleasure working with you guys. I've learned so much and I hope you had some fun. Thank you so much for all the help you gave us during the conference time, and wish you the very best. Please stay in touch.
Hi everybody, my name is Beverly. I'm a first year general surgery resident. I really enjoyed working with Nicole and Belen. In as much as they think I taught them something, I felt like I learned more from them. I wish them the best as they move forward in science.
Our question focused on if nerve blocks and ketamine is the best alternative for an opioid addiction.
To clarify, opioids are still being used to manage pain, but it is not a preferred method since 5 days and up heighten your chances of an addiction.
That's where nerve blocks and ketamine come into play. My topic was specifically on ketamine, and ketamine is a sedation that is used for pain, and it is administered through several routes, but mainly used in IV, and it is a dream-like kind of like sedation. So you still feel pain, but there's no reaction, meaning like if somebody were to get shot, burn or anything, you'd still acknowledge the fact it's there, but it's just, there would be no reaction to it. And unlike opioids where it stays in your system for an amount of period, ketamine is just an in and out sedation, meaning once it comes in, it's easy to come out.
Nerve blocks is more of a injection type, and it's commonly known as epidurals, but it could also be given into peripheral nerves, and that could be very beneficial since it blocks signals from going to your brain, therefore there is less pain, mainly post-op.
Not only did we do research on part of our topics, we were also in meetings and conferences, which benefited us in many ways because we got a better understanding and a personal like, and we were also able to meet their team, which is pretty cool, and see lots of pictures of the patients and see what happened to them.
We also did a stop and bleed course, and we also got to come into the hospital and view patients, and we got to go into the trauma bay and really experience what it's like to be in here in person. And one thing is saying like that you've seen pictures, but one thing is like really seeing it and understanding it.
We were fortunate enough to be able to join Dr. Castanon and Beverly Trotter at a conference where we met a lot of new people. We got the opportunity to sit at Dr. Castanon's conference where we learned and helped.
We were also able to attend conferences, and in this conference we were able to intubate a pig's trachea where we worked with first aid responders. This is a close-up of the pig's trachea. This is a picture of the hospital where patients are set up, and this is where we did our rounds.
In floor 1, the trauma bay is located where room 1 through 8 is dedicated to burn and complex wound patients. This is an example as to what the room looks like.
We were also able to personally observe a nerve blocking being administered, which then after we were able to ask the anesthesiologist any questions we had. What is the problem opioids being prescribed to a patient or the abusive addiction it causes? If there are better alternatives for opioid administration, why has the problem gone up since the epidemic first started?
Why are some people against epidurals and think it creates complications? Why are burns so complicated to treat? Our results are inconclusive due to burns and complex wounds being so complicated.